So Ingo, you don't have any like slides to show or anything, do you?
I don't. I think we sent some all of the things that you wanted to show. I thought we sent that and they were going to, I don't know if in the editing or somehow put that in later.
Yeah,
So,
they'll do that in production once they do that. So our goal is to get this correct. Now the only problem with it is we have on the recording there'll be Michelle's block of they'll fix it, I
Oh,
guess.
no, the way I record it only records the people that are on camera.
Oh, okay. All
So
right.
if I'm off camera, it won't record me.
All right, that's good because it kind of looks funny on a screen to have the two of us and then you just down there as a name. Yeah. All right.
get
All right.
those voice boxes going.
Yeah. Yeah. I haven't spoken yet this morning. I've been up for a little while, but I haven't talked yet. I should have warmed up a little bit.
It's-
Sorry. My lack of preparation. All right. I'm ready to go now. Hello, I'm Dr. Steve Karstensen. I'm the Chief Dental Editor of Dental Sleep Practice, a MedMark publication. Welcome to an educational discussion and Q&A with Dr. Ingo Mahn. You're going to find him fascinating. I have, certainly. In our webinar today, we'll review implementing a win-win workflow model that makes screening, recording, taking diagnosis, and treatment simple, effective, and profitable for your practice. Before we get started, I'd like to invite anybody to use the Q&A feature in the control panel to ask any questions. I'll be able to weave those in through the talk with Dr. Mahn and also make sure we cover those at the end. Anything that we don't get a chance to get to in terms of time, we'll feed to Dr. Mahn and we'll get an answer to you later on. Dr. Mahn grew up in Germany and moved to the US at age 12 and didn't speak a word of English at the time, but he graduated from Marquette University School of Dentistry just 12 years later at age 24 and became a dental CE junkie. You'll recognize some of the names that he studied with, including Peter Dawson, Jim Pride, Dick Barnes, Ron Jackson, Bill Dickerson, Bob Jankelson, Frank Spear, Paul Homily, many others. These are the stars. These are the people that guide us into our very best treatment. And any of you who studied with any of those masters or their second generation following them, you'll know that environment that Dr. Mahn grew up in really focuses on doing the very best. In 2001, he discovered the effect of oral health on the overall health of the body and founded Integrative Dental Solutions. In 2003, he attended a 2-year program at Capital University of Integrative Medicine in Georgetown, was class president, and won the President Outstanding Research Award for his thesis entitled The Science and Sense Behind Biological Dentistry, the only thesis in school history to get perfect scores from all of the reviewers. An early adopter of dental technologies, he's also one of the first users of CEREC and CBC technology and lectured for both of those companies. In 2018, he founded Natural Dental Partners in Phoenix. The practice quickly grew and moved to the new 16 operatory practice in Scottsdale. With 3 associate doctors, Dr. Mann is able to focus his attention now on the treatment of sleep-related breathing disorders. Having been fortunate to study one-on-one with Dr. Ted Belfor, the inventor of the Homeoblock, Dr. Mann founded the Advanced Airway Solutions in 2023 in order to bring epigenetic appliance therapy to the dental profession. Dr. Mann, thank you so much for joining us today. I'm so excited to get a chance to talk with you again about this. And what I want to start with is, well, first of all, you can fill in anything about that history, but what do you want people to learn today? Why should they pay attention to what we have to say today?
Well, for me, it was kind of a long airway journey before I even started implementing airway at all. And now in retrospect, I kind of see what some of those frustrations were. I think all of us who've gone to airway courses, we kind of get bombarded with all of that clinical information, and there's so much new stuff to learn. And then you get back on Monday morning, and we're still kind of excited, but we're still overwhelmed by all of this clinical knowledge. But we really didn't get anything that helps us put that into practice. And so, it's Monday morning, you're putting out the usual Monday morning fires. And, by Thursday, you kind of barely, remember what seminar you even went to that previous weekend. And so I kept going to all of these courses. I'm going, why is this not being put into practice in my office? And so that was kind of frustrating.
Yeah. So today's talk is going to be about how you can take some of that knowledge, and some tips really about how dentists who take these courses or your courses can go back and really put this into practice, make a difference.
Well, I come from a family of German engineers, so I'm kind of a systems and blueprint kind of guy. So once I realized kind of what I needed, I said, okay, I've just got to really systemize this and come up with a good workflow. That a lot of it needs to be delegated, because we as dentists, if we're already doing restorative dentistry and now you're all of a sudden trying to focus on the sleep, it's not really profitable if you're just trading services. So I kind of looked at the clear aligner model, and I really like the fact that you've got people that are taking all the records, and you've got even your team members, like your hygienists, are really diagnosing and seeing these problems, and they're taking the records. Then you send it to, say, if you're using Invisalign, you basically look at a ClinCheck, approve it, and then you've got team members even sending this to the lab. They can even now, with the scanners, these impressions are so amazing. These appliances fit so beautifully that the team members can even do the insertion of the appliances, and you just come in and you spend a lot of time sitting down and communicating and building a relationship with the patient, but not doing so much hands-on, which is great, especially if if you've been practicing a long time, sitting at that dental chair. It's nice to have that type of an option. But I really like that type of workflow because it freed up a lot of my time, and it still created an amazing profit center in the practice.
I can see that for the, if you're thinking about realigning crooked teeth, but when you think about an integrative medicine here, where we're dealing with breathing problems and the fact that that can involve the whole body, all that study you put together for the Center for Integrative Health, for the degree that you got, tell us about how you put that together. That's a little more complicated, I think, than just seeing, following a ClinCheck model. So there's got to be more to it, right?
Yes and no. So definitely the appliance is not, the appliance therapy that we're doing, just like mandibular advancement appliance devices, it's not a magic bullet. It's not like, here you go, this is going to solve all your problems. So it's really part of a protocol. So we do take a little bit, with my philosophy of looking at how we as dentists can affect the overall health of our patients. I'm really looking at more things as well, but I'm really looking at the underlying causes. And what appealed to me about this appliance is that we're not really treating, sleep apnea per se. We're really treating some of the things that contribute, like a collapsing airway. So the appliance we're using is more, rather than something that mechanically moves or changes things, it's really a signaling appliance that gives the body what it needs. And, sleep apnea is this kind of the spectrum. And of course, sleep apnea is the end of the road. So, what if we can give the body what it needs at an earlier stage? And the cool thing is pretty much anybody can use this appliance. We're not, and of course, as dentists, we can't make a diagnosis of sleep apnea anyway, but you can literally give this appliance to anybody and they can benefit to it because of what the appliance does and how it works.
Well, that leads me to, it's difficult to describe an appliance, but give us a couple of basics that separate a Homeoblock from, say, a mandibular advancement device.
So the Homeoblock is essentially a uniblock appliance or monoblock. So you've got a higher bite block on one side, and that at first seems, we as dentists, we want everything to be balanced and hitting evenly. But the truth is that's not how nature works. When we're chewing on food, we're not chewing on both sides at the same time. We're chewing on one side, and that creates strain in the system. And that's really what we lack in modern society, is that lack of strain when we started, cooking our foods, and then the microwaves, and even people who want to eat healthy and are walking around with their green drinks and smoothies. they're getting the nutrition, but they're not getting that strain our body needs to properly grow. And it all starts with things like even breastfeeding. You know, I used to think it was the nutrition of the mother's milk that was created, that really gave the biggest benefit. But in truth, it's the mechanical forces that start that whole process. And I mean, yeah, I mean, look at modern society. We're like, a lot of these kids are behind the 8 ball from, you know, day one, unfortunately.
Yeah, and they're not breathing properly through their nose either.
Exactly.
Yeah.
Well, yeah, you look at the foods, the allergenic foods, and lack of breastfeeding, and there's a lot of, and of course now with all of the devices, the poor posture, you know, as they're looking down at their phones, yeah, it creates a lot of issues.
So that Homeoblock, my favorite word is homeostasis. I just love the concept of the body being able to heal and get back to a natural, you know, state of being. And so Homeoblock kind of implies that you're not just putting in a piece of appliance, you're actually taking care of the whole person.
Exactly. And again, it's really a signaling. I think the first person I heard lecture about this, Dr. Tim Adams, you know, he was talking about quantum physics versus Newtonian forces. And I go, wow, that's kind of an interesting thing to hear at a dental conference.
Yeah.
But, you know, it made a lot of sense, like give the body what it needs. So, you know, the first thing is just that strain. And then the second thing with that extra, usually that bite block is about 4 or 5 millimeters high. And so what the appliance also does is it forces the patient to have to swallow correctly and get that tongue up to the roof of the mouth. And there's actually a little gap between on the palatal portion. There's actually a slight gap there, and saliva builds up there. So when patients first get this, they're literally kind of sucking and putting their tongue up there. So it acts as a myofunctional appliance and helps tone those muscles that help support the airway.
Oh, many of our dentists that are going to be watching this are going to be really intrigued by this concept because they love getting back to the etiology of things as opposed to just treating the endpoint like you talked about.
Mm-hmm.
Yeah. So how does a dentist now, I assume we don't have to talk quantum physics to our patients.
I hope not.
But how do we start that conversation? How do we recognize somebody who might be at risk, and then walk us through, you know, getting started on that discussion?
Well, and that's kind of the biggie, is that we as dentists, when we get a new procedure or do something new in our practice, we don't necessarily want to have to go, okay, now I've got to go market this and run ads or send out flyers. You know, the cool thing is such a big percentage, you know, statistically, 25 to 30% of our patients are, you know, suffer from sleep disordered breathing. And that's just the moderate and severe. That doesn't even count all the people who have milder symptoms. And that's actually, just to get back to the Homeoblock for a second, the other thing it does is it literally downregulates the autonomic nervous system. And even, you know, slight restriction to airflow puts people into that fight or flight mode. And I really think that the magic happens when you can get people out of that sympathetic fight or flight mode into parasympathetic, because that's when our body is able to regenerate and heal. And, you know, unfortunately, I think patients these days live in, you know, they're in fight or flight 24/7.
There's so much technology that's available these days that people are using, Fitbits and Oura rings and circle rings and all kinds of things that to be able to clue folks in. So I think people are paying attention to their bodies more so, at least the ones that want to, you know, seek out care like in our practices.
Yeah. And so, yeah, people are aware of that. I think they're seeing things about sleep apnea and breathing and snoring and the effects of it on social media and other places. And so I think we as dentists are really in the prime position to be able to recognize those, because we have the luxury of seeing all of our patients twice a year, whether whether they think they have a health problem or not. And so when you start to, one of my mentors told me, he says, I'm really giving you new eyes, because once you understand what those signs are, you're like, wow, almost, you know, so many of our patients are really desperately looking for help. And once you start that conversation, you know, you can't look at them and say, I think you have sleep apnea, because they're going to be like, nah, that's not me. But if you just say, you know, hey, how do you sleep? How do you feel when you wake up in the morning? You're like, oh my God, doc, let me tell you. And they just start telling you all of these long stories, and you can only talk so long before the hygienist starts doing this.
Yeah. Yeah.
But we've taught our hygienists we created this impaired mouth assessment form that, points out all of the oral signs and symptoms and then connects it to some of the health issues had. One of my, really good mentors was Jeff Rouse. And I remember he made a statement. He said, when I look at a patient's health history and I see all of these health issues, my first inclination is always show me this is not an airway related problem. And, once you go down that rabbit hole, you realize he's absolutely right.
And it's not just the hygienist either, because the whole team has to be on board with this kind of a conversation. Right.
Yeah. And we create some great, because they also don't have the time to spend. I mean, obviously they have a good amount of time to spend with the patient, but they don't want to keep having that same conversation. So that's how we kind of create this funnel of we take all of our patients, have them recognize the airway patients, and then they give them the educational materials for them to learn more and kind of plant those seeds. And it's funny when you talk to patients about it, intuitively, they go, oh my gosh, like this makes so much sense. And a lot of them have tried a lot of different things. And I always tell them, I go, you've seen a lot of really good doctors that have tried to help you with whatever you have going on. I go, the only thing they have in common is that none of them have ever looked at your airway and your breathing. And to patients, they go, oh my gosh, this makes so much sense. So they're very open to this conversation.
You were talking about how patients are aware of their symptoms and then mentioned, seeing all these doctors. And I hear so many people tell me that their primary care physician just doesn't have time to spend with them on these kind of random questions. Not random, really, but, not associated with the reason they went to the primary care doctor. And
yeah,
so
they really have to have symptoms that are bad enough that they can go, okay, we've got a pill or a therapy for you.
Right.
I think in a lot of ways, unfortunately, the medical system isn't designed to kind of work very preventively. They're very good at like treating the symptoms. And I think you mentioned some of the people I studied with. I think as I was studying this, I think those were the people that really motivated me to always say, I think we can do better. Like we have some great, obviously the appliances we have are life-saving for so many people and they're such effective tools. But I also feel like this is a great thing to have in your toolbox to help people that are kind of on that road to kind of, having these more severe issues down, further on down the road.
Yeah, it's kind of like that etiology you talked about, because I mean, we can make a mandibular advancement device or apply a CPAP or something and get them breathing well tonight, but that doesn't get to the etiology, does it?
Exactly.
Right.
And
Right.
and that's what and that's what this appliance does, is it literally just it tones the muscles, it downregulates the autonomic nervous system. Dr. Belfor used to say, we're really not treating sleep apnea. He says we're treating autonomic nervous system dysfunction. And that's really when people start, because I was just amazed that people would come back 2 weeks after starting this appliance therapy and tell me how it's been life-changing. And I was so focused, as a mechanical dentist, I was initially excited about the fact that as you put strain in the system, these appliances actually do stimulate bone growth over time and remodeling. Sometimes because there is an expansion screw in the appliance, dentists kind of go, well, you can't get, palatal expansion on adults. And that's, of course, absolutely true. But you do get remodeling as the patient's DNA essentially gets expressed in a different way. And so the expansion screw that's in the appliance is not like the expansion screw in like like in an ortho appliance where you're turning the key and you're basically mechanically creating expansion. Literally, as the patient wears this appliance, they have to turn the screw to keep up with the changes. And the cool thing about that is that the appliance in the body also let us know when we've reached that endpoint, because at a certain point, like after about 9 to 12 months, patients will turn that key, put the appliance back in, and now it's going to fit snug. And we tell people, don't force things. We're not forcing things. We're signaling the body. So at that point, they back off, maybe wear a little bit longer. And if it keeps being tight every time they turn the screw, it's like, okay, you're done. And then we make them a maintenance type appliance, which is called a pod, or we keep using the Homeoblock to maintain those benefits.
So it's much more, I guess, participatory by the patient. They're actively part of it, as opposed not by turning a screw, but by paying attention. And we have to pay attention with them. So do we see them like frequently and ask a lot of questions through this time, or how does that 9 or 10 months work if they're following along and they're monitoring symptoms? This can go from something where dentists and engineers and are used to, discrete numbers and boxes to check, as opposed to how do you feel questions. This is a different way of working with your patients, correct?
Oh yeah, definitely. It's not like orthodontics where you can, you're looking at appliance and says, are things tracking the way we want them to? And we do measure a lot of things. Obviously we use the cone beam to look at, but we know how variable that can be. I know you can take two cone beam x-rays, 2 minutes apart and get different looking airways. But we also use the home sleep test, and we use some pharyngometry. But ultimately, I always tell patients what I'm looking for as an endpoint is for you to have 100% nasal breathing and good tongue position. And I said, for you, what we're looking for is there improvement in the symptoms and things that you came for initially? And we have literally a sheet where we list all of the problems that they start with initially. And we even have a system where we say, okay, if your problem was a 10 to begin with, where are you now? And that's what we do at every visit to make sure they're improving. And then and we usually see them about once every 6 to 8 weeks.
Okay.
So it's not too much different from clear liners where you give them enough trays to last them a couple months and then have them come back. And again, my Airway assistant checks the fit of the appliance, and then she goes through the questionnaire. How are you doing with as far as the symptoms? And if they're improving, great. If not, then we look at some of the other things that could be contributing. For example, we don't address tongue ties, for example, at the beginning of treatment. We generally wait. Number one, it kind of overwhelms the patient when you want to do appliance therapy and you were talking about tongue ties and this and that. They just, how patients, they kind of shut down when you throw, too much stuff at them at once. So I just wanted to get them started on the appliance and get them feeling better. And then we reevaluate, are there allergies that are preventing you from properly breathing through your nose? Are there lifestyle changes that need to be made still? Is there tongue ties? So we look at all of the contributing factors that might be preventing them from getting the results that we're looking to get.
One of my mentors, Dr. Pankey, talked about how you allow a relationship to build over time. And yeah, you might be able to see 27 different things that you can do for them, but they're only ready to hear, 6 of those. But and so you get to those later on. So that's what it sounds like you're doing there too, is you're helping the patient realize that, wow, there are a lot of ways I can improve. And when the time is right, when the patient's ready, when the practice is ready, then you can have those discussions.
Yeah, no, and that's kind of what we're seeing, because probably I would have to say 90% plus of the patients that are coming back, even at their first visit at 3 weeks, are already saying, oh my gosh, they literally are holding their appliance like, you're not taking this thing from me. I'm like, no, I'm not. But when they're feeling better already, now they're much more open to hearing what else you have to say, even if they're not, at the point where they want to be at. It definitely makes them much more open to having those conversations.
That's like a lot of dentists that might be watching this have done mandibular advancement devices for their patients. That's a lot of our readers. And oftentimes they say, well, okay, now what? And that's where if somebody's happy, because they're not snoring, happy because they're waking up feeling more refreshed because their airway's propped open with an oral appliance. And where does the Homeoblock come in there? Can you is there a conversion? Can you move from one to the other, or once they started with a mandibular advancement device, does that block them out of a Homeoblock or?
Oh no,
Yeah.
what I like about the Homeoblock too is that it kind of allows the jaw to come down and forward naturally,
Okay.
and you're again you're retraining the muscles and for things to be where they are. So we're seeing patients having significant relief of TMJ symptoms because of course you know that some of those clenching and grinding forces they're putting on their teeth at night are pretty substantial. So by toning the muscles, we're preventing more of that collapse, which kind of reduces the need for the patient to have to do that kind of clenching and grinding. And of course, the goal would be to eliminate it completely. The appliance does generally not do as well with snoring. And so we use the other part of the protocol that we use is we use the Photona Light Walker laser, and we do the night lace protocol. And we've had some, especially since they came out with their new C3 protocol, it's been very effective. That when I had it done, when we were doing the training, I felt like I was doing that coddle maneuver where I felt just such a change in the airflow. And so we're using that in a lot of our patients as an adjunct to reduce the snoring and help improve. You can even go in with the fiber and do nasalays and hit the turbinates and help the collapse of the nasal collapse.
So you're using that inside the nose as well. That's kind of a branching out area for dentists to get involved there. Palates, yes, that's been around for quite a while, but you're working inside the nose as well.
Yeah, I mean, I generally keep it to just preventing the collapse. You do essentially it's the similar protocol to the night lays, and then you just had patients where the nasal cones to try to, and it does seem to work pretty well. I haven't done a lot of the nasal lays yet. I just kind of learned that protocol, but the night lays has been very, very effective.
Well, that's going to be that's going to be an area where dentists are going to feel a little reluctant for a little while, I think. Now, I'm in favor of dentists expanding their field in, trained dentists expanding their field where it's appropriate. But that's going to be an eyebrow raiser for some of our listeners. But that's okay. If you're trained and keep your practice to what is beneficial for the patient and not and low risk, well, then away we go, right?
Yeah.
So,
And with the nasalays, we're treating the floor of the mouth, we're treating the soft palate, and we're treating the tongue. So that's definitely in our wheelhouse.
Right. And nobody else is actually either. That's kind of the interesting part is that what you're talking about can't be done really by any other part of medicine.
Yeah, I mean, ENT are probably the closest, and they tend to want to do take out tonsils and adenoids and do some, sinus type surgeries. But yeah, the airway is kind of that, it is kind of a medical no man's land, that's for sure.
Yeah. Now, in your practice, are you doing all the laser work, or is that something a team member can do, or how does that work?
I do. That's kind of the one hands-on procedure that I still do.
Okay.
Is the laser, but pretty much everything else I've got, I definitely recommend to the doctors that if they want to implement a successful airway program, have a dedicated airway assistant. And I know that can be a barrier, but we're charging about the same as what we would for clear aligner therapy. So, when you think about, if you're doing even just 5 or 6 cases a month, you start to get into, having to deal with the lab and following up. And so I think that's where a lot of frustration comes in, is if you come back from a program like this and you try to put, these tasks onto an assistant that's already probably maxed out as far as, what she needs to be doing. She's like, great, doc, one more thing for me to do. And then when things fall through the cracks, the doctor gets frustrated, the patients get frustrated, the team's frustrated. So, you don't need, you just need to have somebody who's willing to learn and is excited about that, because it's not, it's a lot of it is just more tedious type work and requires good communication skills. But there are people out there like I've found a couple team members that love doing this, and they're excited to be helping patients like this.
One of my early mentors talked about identifying a sleep champion in your practice. And so I think probably a better term these days would be a airway champion, but along those same lines, somebody's going to rise to that level and say, wow, this is the most exciting thing I've ever done. And then they'll take off and run with it from there. And all you have to do is make it possible for them.
Exactly.
Yeah, and so you create the environment, but you have to get your front desk people involved, the finance people, the hygienists. Do you have team meetings about these kind of things? How do you grow that within your practice? Is this part of your training with the advanced airway solutions?
Exactly. Yeah, we have different, like I play this little, video, for example, in my waiting room. I don't have any good magazines there, so I kind of force people to have to look up at the screen and kind of learn about our services. It's probably not so much the front desk people. They definitely know what we're doing, but a lot of my communication is with, the other associate doctors in my practice and the hygienists. So the hygienists are obviously seeing this. They have lots of time to talk with patients. They're seeing the tori, the scalp tongues, the vaulted palates, the wear patterns. They're talking to the patients about the symptoms. They're seeing the health histories. With the type of work, restorative work that we do, looking back now in retrospect at the cases, of course, we always remember the cases that failed. I look back at, some of my bigger restorative cases that failed, and I go, oh my gosh, these were all, sleep disorder breathing patients that were destroying their dentistry. So that's one thing I'm really trying to get across the dentists as well, that this doesn't just help your patient's health, it also makes the dentistry you do last longer and less likely, for patients to destroy it, especially with bigger cases.
I know we're trained in sleep medicine to use screeners like stop bang and Epworth sleepiness scale, but what you're talking about is what dentists can see aren't necessarily things like, well, stop bang, with snoring and all that. We can think about screeners based on what we see in the mouth, the gingivitis, the wear patterns.
Mm-hmm. Oh yeah. I mean, it's all once you understand the signs and symptoms of sleep disordered breathing and the oral signs, you're almost like looking in patients' mouths going, I can't believe I've been staring at this for the last, 40 years and not recognizing what it was all about. But, I mean, we all came from that school of thought where, well, clenching and grinding is due to bite issues, and we were equilibrating and taking off another micron here or there, hoping people were going to stop clenching and grinding. And even when you put in, I never thought about this till later. I go, if the clenching and grinding was a bite problem, why are people, when you put in a night guard for them, why do so many of our patients, destroy their night guard? Their teeth aren't touching anymore, but they're still going through that process of trying to keep, now we know trying to keep their airway open and prevent it from collapsing.
Yeah, I'm thinking that the younger generation of dentists, I'm hoping, just like they're not going to have magazines in their reception rooms anymore. That's something I'm kind of happy. COVID taught us not to have magazines out there. I'm kind of happy about that. I always thought that looked sloppy anyway. But the dentists coming up these days, I think are finally not being taught that occlusion is the source of TMD issues or bruxing, things like this. And we're starting to think more about the physiology of people anyway.
Mm-hmm.
As we consider treatments like Homeoblock and consider treatments like addressing their nutrition needs and their muscle functions, that we'll be able to see more of the whole human that's waiting in our reception room for us to care for them than just their teeth walking in the room.
I think, and you're right, I think we're kind of, we should be moving more towards being, physicians of the mouth. We're really doctors that are specializing in the oral cavity rather than just, hey, here's a hole in the tooth. This is how you fill it. And I think the more you learn, and I did that 20 years ago when I got into more of the health centered, I was like, wow, as dentists, there was a German physician who he spent 40 years studying this. And he said, after 40 years of studying the oral systemic connection, that he goes, I think that 80% of all health issues are either completely or partially related to problems in the mouth. And I thought, boy, even if he's wrong by a lot, it still makes the oral cavity incredibly important for the overall health of the patient. And so I think, I think as dentists, it's a unique opportunity to really have a great impact on our patients. And I think it's just a really rewarding way to practice, to know that you can help patients in those ways.
Yeah, we get to be the actual general physician here. Primary care physicians used to be called, general doctors or general physicians. But nowadays, everybody's so specialized, whereas we still get to enter our patient's kind of healthcare team
Mm-hmm.
as having multiple ways to offer treatments, because we still have holes in teeth to fill. I mean, nobody else is going to do that, right?
Right.
But we also can play our role in healthcare by being primary care. Primary care dentist is a term I'm learning to love in terms of what we can do for people. Yeah.
Well, I think we're really doing a disservice to our patients if we don't look at that, because like you said, nobody else, their primary care physician certainly isn't asking them about their breathing, unless they're, 60 years old and overweight and have a, 20-inch neck. They're not going to get the sleep. They're not going to have a sleep and breathing conversation with their patients.
Yeah, how many like 25-year-old people do you see that are heading towards what we can now know to be decades of healthcare challenges, but at 25 we can do something about it,
Well,
right?
I think this is so. I really think the sleeping and breathing is so fundamental to people's health. And I kind of joke with them. And I said, if you haven't had a good night's sleep and you're not breathing properly, you can take the world's best multivitamin and see the world's best doctors. You're not going to get better. And Dr. Liao was one of my mentors, and he had a great saying. He says, our airway is like to our health is like, it's like the roots to a plant. And it is. It's like, it's so foundational that if you don't address that, and if your body's in fight or flight, and your cortisol levels are up, and you're not healing, you're always going to have those challenges. But that's the problem in medicine, is they really don't have any solutions until things get bad. So that's what really appealed to me about this appliance, and that's why I've tried to really simplify it. The design of this appliance is actually incredibly easy once you know how to do it. So, we have a whole system where when we gather the information, I have this template that the Airway assistant puts all of the information in. It's almost my version of a ClinCheck. And so I basically take that and just kind of modify it, look at it. I say, what side do we want to put the block on? And it's really a matter of 5 or 10 minutes of my time to go over the home sleep test, look at the imaging, look at all the data, and then I sit down with the patient and we put that all together into a really nice report for them. And by the time they get, with the education we do, by the time they get in front of me for the consultation, they already know, they're already very well informed and educated. So at that point, it's really just a matter of, how do we make this affordable? And of course, that's of course a big sticking point in sleep dentistry and medicine, is how do you get paid for these things?
So is this paid for by medical insurance then?
Right now, it's not. Right now, and you obviously know a lot, a lot about this. You're an expert in this. It's tough to get paid for. They are cutting edge appliances, but and we're working on getting reimbursement for that from medical and dental. But the truth is, people, when they look at the issues they're having, it's kind of like Invisalign. I mean, how many of our patients have coverage for clear aligners? But when they realize they have the issue and they want it, they understand the value. And again, we kind of keep the cost in the $6,000 to $7,000 range, which for most people, when they see the benefit of how this is going to change their life, our acceptance rate, if you go through that process and that system, by the time the patients you're sitting to, they're sold on this, and it's just a matter of, okay, let's figure out how to work this into your budget.
So I know photographs are a big part of your workup as well. And so having their face in front of them and you can able to show them some of these imbalances that you showed us when I was in your class, that's pretty powerful, isn't it?
Mhm.
Yeah.
Oh yeah, and there when they see, whether it's their forward head posture, the asymmetries, um, they kind of go, yeah, I kind of knew this was happening, and so you know, waking up and being tired all day long, if you could tell people, hey, I have a solution this is gonna help you feel better, uh, they're willing to make that investment. I tell them, I go, you're gonna spend way more on all these supplements and coffee than this Homeoblock is gonna cost you over the next couple of years.
That's right. Who wants to take another pill? I mean, we're tired of being told we need to take more pills. And, I think about the restorative dentist out there because as a coming up restorative dentist, and you studied with us with those people as well, we were taught to take great photographs of their occlusion, great, fantastic pictures of their smile to help them see how we could, meet some of their wishes and desires and some of the things that we diagnosed. But you back up and take pictures of faces and posture and things. Not a difficult move for a dentist who's used to taking pictures, but gives us a
No.
whole nother way of communicating.
Oh yeah, and we literally just use an iPhone. We put up this little, it's called a posture grid that you just hang on your wall and they stand in front of it. And it's very simple. But when people see themselves standing in front of that and they see, like I sat at a dental chair for 40 years. So you see my shoulder, I'm off too, but you don't always sometimes recognize it till you see a picture and go, whoa, like look at that. I'm way out of kilter.
Yeah.
Uh, and again, it's very easy. Our team members are used to taking pictures. I didn't want the big Nikon camera with all the ring lights. The iPhone takes such amazing pictures, and we have it set up where it literally just puts it right into a certain folder. When they take the pictures, I can, see it on my computer. And again, to me, everything is about simplifying that workflow. Uh, if it's hard and tedious, it's not going to get done in the practice. And even the appliances, I love the fact that patients love them
Mm.
because I tell them, I said, if it's something that's hard for you to do, and even if you have good intentions, the thing's going to end up in your nightstand. So I really love the fact that we're making an appliance for patients that are coming back and saying, I really love wearing this because I know they're going to keep doing it.
Right. When people can touch a solution, they can feel the difference for themselves, and they can connect it with problems that they brought up with our interview type of questions, then that's going to lead to more successful outcomes.
Mm-hmm.
Yeah.
Oh, and we're seeing that because, patients are referring, all of a sudden we've got, it's always in a health center practice, it's always the wife that comes in first. Men don't tend to go to dentists like me. So, but, within a short period of time, they're like, oh my gosh, my spouse needs this or so-and-so needs this. Um, and, when you're getting good results, you're going to see those referrals and people that are coming into the practice already saying, hey, so and so did this and it really helped them. This is what I want. That obviously makes life a lot easier for us as well.
And we don't, like you said earlier, we don't have to spend money on billboards and radio ads and television and other things like this. We can just let people talk about how much better they feel.
Mm-hmm.
Yeah.
And I have scripts for that. So, when the hygienist says, hey, I see you've been like battling this high blood pressure or whatever it may be, did you know that they're now showing that there's a correlation between sleep disordered breathing? Is this something you'd be interested in learning more about? And, who's going to say no to that? And then we try to remove again the barriers of entry. We do what we call our airway assessment, where they now see the assistant for about an hour, where she takes some of the pictures. We do the optical scan. We usually already have a cone beam scan, and then we send them home with a home sleep test. And just using that data, we're able to make design of this very simple appliance for them, and it's a very nice, easy workflow. It's just a matter of kind of having the systems and having the right tools and scripts that makes everything flow very smoothly. And you've got a ton of patients, in your practice that desperately are looking for you for this help because they're not going to get it anywhere else.
Through that, yeah. So tell me now. You mentioned sending them home with a home sleep test. That brings up a question. Most states, dentists can do that. But what do you do with the data that comes back? How do you interpret that? Do you have that read by a physician, or what? Is there like a cutoff where you see numbers that you are uncomfortable with, or talk us through that a little bit?
Yeah, so I've used a number. I've started off with a watermark, Aries watermark, home sleep test, and the watch pad. Right now, I'm using the sleep image ring. It doesn't give me and I think we had talked about the fact that it doesn't give positional data, but what I like about the sleep image ring is a couple things. Number one, it's extremely easy to use. We set up the app for the patient. When they get home, they put the ring on and hit start on their app. And so it's extremely easy to use. I also love the report that it generates because it's kind of a color code. It talks about sleep quality, it talks about sleep apnea, and a couple other things. And it basically has green, yellow, and red blocks.
Right.
And so when you sit down with a patient, they're looking down and they're seeing these red blocks and they're going, they're in their mind, they're going, okay, red is not good, right? But I do look at if we see high numbers that indicate that they have sleep apnea, we tell them we're not making a diagnosis, but if it's a certain level, we do recommend that they see a sleep physician or an ear, nose, and throat specialist. Or if we see the sleep imaging also can detect central apneas. So if we see that, those are things we refer to, because I don't want to be making an oral appliance for someone who's got a really severe problem or some kind of a neurological problem. But with women, I show them the test. A lot of them will not have any apneic hypopneic events, but you look at the fragmentation of their sleep and their RDI, their respiratory disturbance index. I show them, I go, look, you still have compensatory mechanisms to prevent yourself from becoming a sleep apnea patient, but you're paying a health price. And they go, yeah, I know. I feel like I'm in fight or flight, or I feel like I'm never rested. And so they get it. They've maybe even had sleep tests, lab tests done where they were told they were, normal.
Yeah.
But they go, I can tell I'm not normal.
Yeah. So many of those patients have a story about going to the doctor because they don't feel normal. And then but they don't have, the physicians don't have a mechanism for identifying these symptoms or these problems that don't lend themselves to a quick label like sleep apnea. Yeah.
So we're really kind of using that home sleep test to be a screening device, kind of like, if we're checking for our blood pressure, if we see, if it's elevated to a certain point, it's like, okay, you need to go see a person that can handle this. So we're using this more as an educational and as a screening device, and as a baseline, so that we can show them down the road whether or not, what we can test to see whether or not things are getting better. But it's a great effective tool for that.
So when you talk to people about this, and especially that woman who's been to a sleep doctor, maybe because somebody told her to, and she had a sleep test, and they told her there was nothing wrong, and now you're telling her, wow, let's see all these symptoms. So that can be a challenging conversation there too.
Well, I think the thing is they're having this sleep test done because they know already that things aren't right. And when I explain to them, look, when you're clenching and grinding your teeth, when you're doing these different things to keep yourself breathing, that will still prevent you. That's a protective mechanism that's working right now. That's going to become less and less effective over time, but it's still working right now. But you're paying that health price because your body's at night is never in that state where it can properly heal and recover. And over time, that's just going to get worse and worse. And when I'm having this conversation, it's actually a fun conversation, because you can just see people kind of light up and go, oh my God, that makes so much sense. I can't tell you how many patients have said, they say, I've talked to 12 different doctors, and what you say makes the most sense. And I go, I would never in my wildest dreams ever thought as a dentist, someone would tell me that they've talked to a bunch of doctors and I make more sense than they do. I'm like, well, that's kind of cool. But it is, because we're looking at something that nobody else is even paying attention to.
Right. That's one of the certainly one of the big rewards of doing this therapy is when somebody looks at you with finally they have some comprehension that there's a reason why they feel like they do.
Well, and the cool thing is a lot of the both natural and conventional physicians that I deal with, when I talk to them about this, they get excited because they have, they're having more and more challenges keeping their patients healthy, because if they're not addressing that, they're trying to get their cortisol levels down. They're trying to address all these different issues, and they've kind of hit this brick wall. So when I start talking to them about sleep, they're like, oh my gosh, I never even thought about that. And that really makes, once this takes off in your practice, you're going to start seeing a lot of practitioners that are going to be sending you patients. And when these patients come in, they're already pre-qualified. They're already coming in looking for this treatment. And we have some really good tools that help you kind of build those networks with practitioners in your area, because trust me, there's not a lot of people treating at this level. So when they hear about this, they actually get very excited.
So how does that work? I mean, I get that for many of the doctors, but there'll be some doctors out there that say, well, wait a minute. They're not old and fat, so they can't have obstructive sleep apnea. And they haven't been trained in sleep nuances, especially. They may have heard of OSA, and they know about CPAPs. So now you're coming along saying, wait a minute, there's some things that aren't really obstructive sleep apnea that we can treat with this device. So there's going to be some skepticism out there too. So talk about how you get through that. Kind of a new practitioner you may not know very well yet.
Well, and I wrote almost like a little book of some of the common questions. So one of the things I do is I have I'll just go into some of these practices and talk to the doctor myself, and they'll tell me some of the challenges that they're having. They, a lot of them say it used to be pretty easy. Someone would come in and it would be, one or two things. If I gave them the right supplement or did this or that, they would feel better. They said, now I really feel like it's a challenge. Like there's so many things. And when I just start talking about the breathing, they're actually surprisingly interested. And when I talk to them about even resistance to airflow, how that puts your body into that sympathetic state, they get it. They actually understand it very quickly. I think sometimes dentists are almost more resistant to hearing these things than medical doctors.
Okay, that's good to hear.
Yeah.
So how do you see dentistry evolving in this area then? I mean, your background, you went to school I'm really intrigued about the school you went to in Georgetown, but how does that start to integrate it more widely into dentistry?
I kind of got into that because, again, I'm always looking for the root cause. I'm always looking to see how I can do better. And like I said, with the mentors that I had, they were all not happy with where things were at and wanted to take it to the next level. So when I got into health more, like back then, holistic dentistry was like I remember when I first, would go to reunions and I would tell my classmates, oh yeah, I'm doing holistic dentistry. And they kind of give me the little pat on the back, like that's nice, and walk away. And then like, it's one of those crazy guys.
Oh yeah.
It's interesting now when you tell people, even dentists, like they go, oh, really? Like, tell me more about that. So I think we are realizing as a profession that the influence, the impact that the mouth has on the overall health, and so I think there's more of a desire to learn about that. So when I first got into that, of course, we had a ton of patients coming in with mouths full of amalgams, and they were saying, hey, I want to just get my mouth cleaned up. But I saw this program that really kind of dug a little bit deeper, and so I thought, I'm never going to be practicing integrative medicine. I really wanted to learn about those things so I could communicate with my patients' practitioners, because they were seeing craniosacral therapists and acupuncture, all these different modalities that I didn't know anything about. So I went through this program more to learn for communication rather than actually practicing that. So I never have practiced integrative medicine, but I've always felt like it was a good thing to have in the back of my mind, so that when patients come in and they ask you about something and now you know exactly what they're talking about, you build a really good connection. You're not telling them they're crazy for seeing a chiropractor. Um, then you build that relationship, because until they trust you and feel like you've heard them and understand them, they're not gonna have you do treatment on them.
Right. If somebody walks in and says, I see a chiropractor, and your attitude is, well, that's wrong. You're not going to get very far with being part of their healthcare team. And you say you don't practice integrative medicine. I can't imagine that to be true. I think you're fully into integrative medicine. You just do what you know how to do, and the fact that you can discuss things like craniosacral therapy and chiropractic and posture and other things with patients, and how it integrates with their homeostasis. I believe that's completely what dentistry should go for there. Tell us about myofunctional therapy. Go ahead. I'm sorry. Go ahead.
No, I was going to say, I just really see myself in staying in my lane and being part of a healthcare team, because right now a lot of my patients are referrals from people who practice, say, functional medicine or chiropractic or whatever. So number one, I just want to understand what they do, and number two, I don't want to step on their toes and do anything that they're doing. And I feel like that's, as dentists, we sometimes get ourselves into trouble when we stray outside into things that we probably shouldn't be doing. So I just want to know about it. I want to be able to communicate with these practitioners, and I want to do what I do the best possible way.
Tell us about myofunctional therapy, because that's a kind of a big deal in dentistry these days. Are you you have myofunctional practitioners in your practice to go along with?
So we work with a myofunctional, one of our hygienists. Well, she actually just left because she got so busy with her myofunctional practice that she, is just doing myofunctional. I also have a physical therapist now that just joined our practice, and she's trained with the Postural Restoration Institute. So every patient, and it would be just as easy to refer to someone, but I refer every patient when we see the poor posture. We give them a half-hour discovery visit with this physical therapist, so she can evaluate them and work as part of the team as well. But that's a great thing that if you go around and talk to chiropractors and physical therapists, a lot of them would be interested in working with someone who treats airway, because I think they understand some of these issues.
So tell us a little bit more about advanced airway solutions. I mentioned that at the opening, and people are asking about that now. So you've opened up a lot of avenues for us to learn more. But is that what you teach there at your institute?
Yeah. So like I said, my big frustrations were that that all of the courses I took they were focused pretty much 100% on clinical and very little on implementation. And then there was one company that charged a lot of money to educate patients, and I kind of felt like it didn't need to be that complicated. I find that this appliance, because of the way it works, is easy to design, and it keeps dentists out of trouble, because we're not moving things around and deciding where things should be. Again, it's just a signaling appliance. So what I did was I said, I just want to do and I've actually simplified it. Even since it used to be a 2-day course, I've actually reduced it to a 1-day course that focuses very heavily on creating that funnel, on putting the systems in. Of course, we give doctors all of the basic clinical knowledge of what the problem is, how the appliance works, and all of those details. But a lot of it is giving dentists the tools they need to put it into practice, because I feel like once the dentist sees, oh, this is easy to do and easy to implement and it's profitable, now you can dig a little bit deeper in with this appliance. You can get into all of the other facets, but you don't have to. You just putting that appliance in patients will feel better immediately. So we have it set up. Okay, let's get you started. Here's how you can get the program into the practice. And then we build a platform, kind of like our own, Facebook type of thing, where dentists can be part of that after the course, where we can have a forum, we can communicate, we can have all of the resources on there. So I try to really make it simple. It's got to be doable. I feel like my favorite saying is education without implementation is just entertainment. And I tell dentists, I go, I'm not here I don't want to entertain you. I want to give you the tools that you can come to a course on a Friday or Saturday at my office in North Scottsdale. We're about a block from Spear Education. So it's a great area. And I want you to be able to leave and say, I can do this, and I can go back to my office next week and actually start a case and get this going.
Do team members come to this class?
Yep.
Yep.
And we also, as part of the program, we have one of the most powerful things for me. Like, I went through LVI and I somehow got wrangled into being a patient, because you have to bring patients there. And there were a couple of dentists who didn't have patients. So next thing, I'm not just treating a patient, I'm also getting worked on. And afterwards I thought, I learned as much being in the chair, if not more, as a patient and having this done on me than I did as an attendee. So one of the things that we're doing is we're having dentists send us an optical scan, a cone beam, and we send them a home sleep test, and we actually fabricate a Homeoblock for them that they can insert on each other and leave with one of these appliances.
Wow.
So it's a great experiencing it yourself. Like, I wore an O-ring. I only get 15 minutes of like deep sleep. And first night I wore my appliance, I got an hour and a half. And I was like, wow, that's it's very powerful, and now my wife wanted an appliance. I've got my daughter in an appliance. There's nothing like doing it, like experiencing it yourself. It's very powerful when you talk to patients and go, hey, I believe in this enough to do it on myself and my family.
Yeah, that is powerful indeed. Yeah. Well, I can't believe we spent a whole hour already talking about this. And thank you for all your questions, people online. We've gotten through those. I wove those into our conversation here. So I think we've been able to cover most everything. And but we're out of time. If we didn't get to your question, we will absolutely be able to submit those to Dr. Mahn, and he's agreed to answer those questions online for us. So thank you so much. This is fascinating to me. And I went to your class. I thoroughly enjoyed that. I hope that other people will do that as well, because it's such powerful and new ways of thinking, but not like weird ways of thinking. This is just taking what we already know as doctors and applying it more widely to our patients' physiology. And my mentor, Dr. Pankey, started talking about this in the 1930s. So this isn't new. This is just being good doctors for our patients. And that's what our community needs for better health. So thank you, Dr. Mann. Thank you for sponsoring this with the Advanced Airway Solutions. And thank you, everybody. Any last words there, Ingo?
No, I'm just really, I never thought I would go down this rabbit hole. I certainly never thought I would be, getting into the education space. But once I started doing this, I got so passionate about it. I'm like, I've got to get this to dentistry. And I wanted to do it in a very affordable way where people didn't have to spend tens of thousands of dollars to learn about Airway. And I thought, I just want to get it out there, because our society really needs this so desperately. So it's a very exciting path to be on. And by the way, the website is just myairwaytraining.com. I don't know if you'll have that on there, but we have a website where you can sign up for the courses. And I'm just excited to meet all the doctors and get this to our patients.
Absolutely. Thank you so much for your time. I appreciate it. And thank you.
Well, thanks for having me, Steve.
Absolutely. All right. Good night, everybody.